talking about. If I may, can I take us back to an era, a previous geological era, the 25th of February 2020, when I published my 10 years on report. And I was thinking what Nigel Topping said about don't lead on climate. And I was thinking, how would I say that about health equity? Now, what I said in my 2020 report, and what I've been saying for a long time, is that health is a good measure of how well we're doing as a society. And health inequalities are a good measure of how unequal our progress is as a society. So would I say lead on health equity? I would certainly say take actions that would lead to better health and a fairer distribution of health, because that's a good marker that we're moving in the right direction. I would also add that everybody values good health. It is a goal that all individuals have for themselves, their families, and that it's a goal that we should have as a society. And I've tried to convey, some people say it's a fiction, but I've tried to convey that I'm not party political in what I'm saying. I'm looking at the evidence. And my evidence in 2020 was that we lost a decade. And it shows that the speed of improvement of life expectancy slowed dramatically and just about ground to a halt. Health inequalities continued to increase. And shatteringly, if you look at life expectancy for women, in the most deprived 10% of areas outside London, it went down. It seems to me saying that we've lost a decade is an evidence-based description of what happened. Life expectancy stopped improving, health inequalities between socioeconomic groups and regions continued to increase, and life expectancy for the poorest women outside London went down. Mm. That's a terrible indictment of what we did as a society. So when the pandemic crashed upon us, we were totally ill-prepared. We were in a pretty bad state in February this year. When it happened, if you'll forgive a personal note, I thought, well, I'm not a communicable disease expert. I don't know about control of pandemics. I'll leave it to my public health colleagues who do. I'll sit this one out. But very quickly, it became clear that, as I've said, the pandemic exposed and amplified inequalities in society. There's no way I could sit this one out. It was a major challenge to inequalities. The fiction at the beginning that COVID-19 was the great leveler, prime ministers, princes, football managers, actors, the elite of, I'm not quite sure what order they go in, football managers and princes, but they all got infected. So it was the great leveler. And that was revealed to be a fiction pretty quickly. I always want to applaud ONS. We're blessed with a brilliant statistical service. ONS has been brilliant, and Public Health England have been very good in bringing the evidence to our notice on a regular basis. And what you see, the mortality from COVID-19 follows the social gradient. It looks very much like the social gradient in all-cause mortality. The more deprived the area, the higher the mortality from all causes, and the higher the mortality from COVID-19. It looks very similar, which means that the social determinants of health inequalities more generally apply to the social determinants of inequalities in COVID-19, with some excess at the bottom end, the most deprived, which arguably relate to employment in frontline occupations, multi-generational, overcrowded households, and the like, that put people in more deprived areas at even higher risk of COVID-19 than they are of heart disease and respiratory disease and other causes of death. And then we have the BAME mortality. When Public Health England published its report showing the high mortality in BAME groups, I was on the BBC Radio 4, and before me was a senior politician who said he was terribly concerned about this, and members of BAME communities should wash their hands and practice social distancing. And I said, I was asked what I thought. I said, very good advice. And we should deal with structural racism. But what should we do tomorrow? Tomorrow, we should deal with structural racism. It's no accident that people from deprived communities and from BAME communities are the ones exposed to frontline occupations, are the ones who live in overcrowded households. Is there a genetic component? Yeah, maybe, but who cares? That's not the issue. We can't do much about the genes, but we can do a great deal about living conditions, and we can do a great deal about racism and discrimination that consigns people of color to less fortunate positions in society. So when I say that COVID-19 amplifies as well as exposes the inequalities in society, that's what I'm talking about. Structural racism, but also social and economic inequalities. What do we do next? I'm chairing a subgroup of the Climate Change Committee, which was asked to look at how actions to improve health could contribute to reduction in greenhouse gas emissions. I figure if they were silly enough to ask me to chair it, they had to expect that I would talk about health inequalities. I mean, what else is there? And one of the members of my group said, I don't think you want me on this group. This sounds like social science. No, you know, air pollution's important, but air pollution is unfairly distributed. The more deprived the community, the more you are exposed to air pollution. So we think the Climate Change Committee, we've asked to do this by them, and we'll report to them, but they encouraged us to report separately, which we may try and do perhaps September. And we're looking at energy production, housing, or buildings, transport, food, and work, and show how what you would do in each of those domains to improve health, to reduce health inequalities, can contribute to reduction of greenhouse gas emissions. And so energy production, if you have cleaner energy, there'll be less air pollution. So quite apart from anything else, there's common cause here. Burning fossil fuels is bad for people's health. Having more sustainable, renewable energy would be better for people's health. Active transport, again, walking, cycling, public transport contributes to reduction in greenhouse gas emissions, and it's good for health. Buildings, cold homes, winter excess mortality, better insulation of buildings, uses less energy, and is good for people's health. Food, meat, methane production from cattle is a contributor to CO2 equivalence emissions. switching to a diet that's more sustainable will be good for people's health, more fruit and vegetables, more pulses, grains, etc., and will lead to reduction in greenhouse gas emissions. But as I said to my subgroup, take food. I had in my 2020 report a graph from the Food Foundation. If people in the bottom 10% of households followed the healthy eating advice, they would spend 74% of household income on food. It's just not possible. So healthy, more sustainable diets have to be taken in the context of affordability. Work. If I may, I went back to relook at John Maynard Keynes' 1931 essay, The Economic Possibilities for Our Grandchildren. 1931, the Great Depression. Keynes said in 1931 that in the next 100 years, by 2031, the economy will have grown 7-fold in real terms. Well, after 80 years, it had grown 6-fold. So he was pretty good on his prediction. The bit that he got wrong was he said, we'll be so rich. I mean, the miracle of compound interest and scientific discovery, the economy will grow. We'll be so rich that we'll only need to work 15 hours a week to sustain ourselves, 3 hours a day. So as we think about building back better, what will be the nature of work? The next pandemic is automation. And like all pandemics, that will increase inequalities. And as we think what the nature of work will be like as we build back, how do we get a fair distribution of resources so people can live, enough work so people have a meaningful role in society? And what will the nature of work look like? The one thing we know is that the status quo before the pandemic was not desirable. That's what my 2020 report said. And I'd like to think that the recommendations in my 2020 report have even more relevance now as we think about what building back better looks like as we emerge from this pandemic.